welcome Jason Panasuk. He is the Director of Finance for a large healthcare organization out on the West Coast. So again, I ask you to give your attention to Jason. Thank you so much.
Hello. Are you able to see me?
Yes, we can see you and we can hear you.
All right. So I'm going to just bring up my presentation here. And thank you so much for having me here today. So, as Dr. Shepard mentioned, I'm the Director of Finance for a region of a large healthcare system on the West Coast. I live out in Portland, Oregon. And I'm familiar with the Midwest. I actually grew up in eastern Montana, so not terribly far from South Dakota. And I lived in Minnesota for a while too. So that's kind of taken me back to spend some time with you guys. But anyway, so I wanted to talk a little bit about what I do in healthcare and how I use technology, which quite frankly I use just about every day. And we use it in ways that we work in finance. You might think of the old way of finance as just working with numbers. And while that's largely true, we do a lot of work on the data side as well. Especially when we're working with, in my role, I have worked for both individual hospitals and also now for a region which involves 3 hospitals. And I collaborate with our corporate office. There's a total of 20 hospitals in our system and quite a number of clinics. And when we get out into the field, finance professionals often serve as analytical data support for the individual hospitals who may not have the same resources as a larger corporate office or a larger system. So these are some of the areas that I work in, and these are different systems and different areas that we work in, and I'll go into depth on a few of them. I'm not going to talk about each one of them individually, but I'll go into depth on a few of them. But just to kind of go through the list here, the ERP or Enterprise Resource Planning Systems, you may have heard of those in other business terms, but they're large systems that are designed to kind of coordinate all the areas of a business. And that works, at least in our system, in close conjunction with the EPM or Enterprise Performance Management System, and as well as the human capital management systems, that basically those pieces work all together to do a lot of the financial work of the organization. Also, revenue cycle management is a huge part of healthcare. It's very unique in healthcare. We'll talk a little bit about that. Data analytics is, again, one of the huge parts of what we work with in healthcare. And we get to dabble a little bit, even on the finance side, we get to dabble a little bit with the electronic health record and the clinical data focus. And really all that adds up to some of our jobs, reporting, forecasting, and then also I put in a little blurb about how we use technology to really collaborate in the 21st century now. Kind of like what we're doing right now. We do that to create efficiencies. So I'm going to talk a little bit, first of all, about our enterprise resource planning. And this is kind of a fun one to talk about for me because we actually, as a system, as our system that I work for, we just spent a lot of time transitioning our entire system to a centralized ERP system. That was just last year in 2017. And it was really fun to be a part of it. I actually personally got to be a part of the project and spent a lot of time helping plan the statistics piece of that transition. So really what we did is we took our 20 hospitals who were functioning on 20 different individual systems, and we consolidated them all onto one single system. And what that ERP system does for us is it helps us centralize transaction processing. So if you think of a month-end process in accounting and finance, what used to be happening at 20 different hospitals, we now have the ability to work together and make it all happen in one place. We also tied into that supply chain management. So basically, we are working together for value-based purchasing, helping contracting, and it really, what that does for us is it helps us drive down our supply costs. We have some initiatives as a system, and as you can imagine, as a healthcare system with 20 hospitals up and down the West Coast, we have some significant supply costs that we have lots of opportunity for efficiency there. And then one of the other functions that is still kind of, we're working to build up even better is cost accounting. And I'm going to talk more about that one in detail on the next slide because I thought that one was so important. But I just mentioned it here. So, and how does this technology help you in healthcare? So, you know, maybe you work in healthcare, maybe not in finance specifically, but all these pieces come together to help you understand your core business. So let's say you're an operational leader of maybe a physical therapy portion of a healthcare practice or inpatient practice or some other service line. These tools really help us understand how our business functions, where our business comes from, how the revenue is driven, and the costs, and how they all work together. And so what this does is it allows us to work with this data to build that understanding and then help the operational side of the business really make good decisions using that data. Benchmarking, so labor, and I think I'll talk about this more again in the EPM section, but you know, one of the huge things is really understanding how do we best run an organization efficiently. You know, we want to make sure that we're staffing appropriately. So, you know, this is just one piece. There are other technology tools out there that live in, like, say, for example, a nursing unit that help them really focus on staffing resources. We need to understand, especially in modern healthcare, volumes are shifting. We're seeing things move from the ascent is to move from more inpatient transactions to trying to do more preventative health and outpatient care. And as that happens, we need to understand how our business shifts and be able to react appropriately. So I want to spend a little bit of time talking about cost accounting. Cost accounting is pretty unique in healthcare. I feel like it's the area where it's very challenging. So we hear a lot about, perhaps in the media, about the cost of healthcare, especially in the United States. And what does that mean? Well, and you might hear things from time to time, well, it costs X number of dollars to have a procedure done at hospital A, and it costs this much at hospital B. And it may seem kind of odd that why such a difference? Well, one of the things, if you're not familiar with healthcare finance or how it functions, is really what the challenge is healthcare doesn't function like a store where we know exactly, you know, we paid $5 for this unit, we're going to turn around and sell it for $8. There's so many complex things going into patient care. Let's say you have a patient that comes for an emergency room visit, and ultimately that emergency room visit turns into an inpatient stay. And maybe during the length of that stay, they have maybe images taken, they have labs drawn, they have perhaps after the inpatient stay, there's some rehab or during the inpatient stay, there might be some rehab that goes into it. And each of those areas are different pieces of the puzzle of that drives that single encounter. And so how do we have to pull all of those pieces together to understand what did it cost us to provide care to that individual, and then what do we earn for doing that? And while that's a bit of a different challenge than cost accounting, the earning side of the equation is very complex as well. And so it really behooves us in healthcare to understand the cost of what we provide, of the service we provide on a detail level. And that there's actually entire systems, entire software systems designed specifically for this function. And then we can start to see where opportunities lie. I mean, you think about, I'm going to go back to the example that I talked a little bit about earlier of an operational leader who maybe you're a director of a physical therapy portion of a healthcare practice. You need to understand what it costs you to provide that service so that you can find your opportunities. And then as we think about it further, as we're moving into more consumer-based healthcare, there's a little company out here in Oregon. There might be something similar in other parts of the country, but there's a little company out here in Oregon called Zoom Care. The whole idea about it is small little one-stop shops for your primary care services, and they place them in locations that are popular with maybe in an apartment building downtown, in locations that it's not just going to a big hospital or a big clinic. And so we live in this era of consumer-driven healthcare. And one example of that is here in Oregon, there's a big push for more price transparency. And while that's still a challenge, and it's still, I have just a brief screenshot, which is probably difficult to see here, but there's a website that the state of Oregon runs called Oregon Hospital Guide that allows you to compare, as a consumer, to compare the cost of the different healthcare organizations. So maybe for a certain procedure. But even outside of that, there's still a lot more complexity that we need to understand. So I'm going to move on to enterprise performance management. So this EPM system, this really works in conjunction with our ERP system that I talked about earlier. So this is where we take all of our data from our transactional processing and we turn it into actionable information. We spend time analyzing it. We set up budgets and forecasts. We set up financial reports, variance analysis. It helps us understand where are our gaps, how are we expecting to perform in the future based on information that we have from both historical and from on new information coming from the healthcare world. So CMS publishes new reimbursement rates, or we get new information on volume that is going to be shifting or something like that. And so this is where these two systems really work together to help us understand that. And so this is also a place where we start to pull in some of the patient data. And the reason why we do that is we need to understand things like, I'll explain for a minute how CMS reimbursement works on a DRG basis if you're not familiar. But basically, CMS pays DRG hospitals or large hospitals based on the diagnoses of the patient, the inpatient case. CMS has what they call a DRG. And that DRG has a weight associated with it. The idea behind that being that more complex DRGs or more complex or acute cases actually require more intervention, require more resources, and therefore Medicare or CMS will pay more for that service. Then it's up to the hospital to provide that service within the revenue that they're going to receive from CMS at that cost. So let's say, for example, that some sort of trend in healthcare or in your community is shifting, and maybe maybe it's the flu. Maybe the flu is there's a new rampant cases of the flu, and that shifts the type of cases that are coming to your facility, and therefore shifts the amount of reimbursement you're going to get. We can't just assume that it's going to be static, because if the cases are becoming more acute or less acute, even if we get the same number of cases, we need to understand what's happening with them so we can understand how our revenue is going to shift based on the changing information of those cases. And also similarly, we also have to understand what we call the payer mix, or in different areas. I mean, you can be in a single metropolitan area and the payer mix is vastly different from one community to the next. And that means that maybe in one community you have a high degree of Medicare, and in another community you have maybe more Medicaid or commercial payers, and all of that needs to be understood and the trends around it. And so that's what this data, pulling in this data from the patient information and then combining it with the financial analysis, helps us to understand our business more. Human capital management is another thing that is it's a newer, for our organization, it's a newer technology that is now centralized as well. This helps us drive efficiencies through, here's an example. We have some facilities in California that there might be two small hospitals that are pretty close together, maybe 10 to 20 miles apart. And they might share staff. Maybe the one facility needs a couple nurses for a day or something like that, and so they share staff back and forth. These new systems, as they're basically HR systems, or what we would consider HR systems, allow us to basically have a centralized process for hiring, compensation management, and that these benefits, the compensation, whatever, would all be relatively constant in terms of policy from one facility to the next. So it's a way to create efficiencies and also improved processes for that area. Revenue cycle management. This is a huge area in healthcare. It's extremely complex, and I would say it's got a massive amount of opportunity in this space. When I say opportunity for finding new and better ways to do things. Revenue cycle management, as we know in the United States, the way that hospitals or healthcare gets paid is very complicated. We've got many different payers. Every one of them is different in how they pay. Medicare pays largely on DRGs. We have critical access hospitals that are cost-based reimbursed. We have commercial payers that every contract is different. Some of them pay on a per diem basis. Some of them pay on a similar to Medicare on a DRG basis. Not very many are left that do this, but some of them still pay on what we call a percent of charge base, where if we charge $100 for a service and our contract says they'll pay 75% of that, then we get $75 for that service. And so what revenue cycle management does is, after the patient has had this service, this is where revenue cycle starts to go to work. They do the coding to determine, well, what exactly, remember I was talking about those DRGs earlier, what DRG, based on the rules, does this particular case fall into, and what can we expect from reimbursement for that? So there's the coding piece, there's billing, there's medical records, and it's a very complicated space that some data is showing that right now the opportunity is on average up to $22 million a year for your average medium to large size hospital. So that's a lot. If you think of it in terms of a large organization of hospitals, like the one I work for, where you've got 20 hospitals, and you think of that compounded times 20 hospitals, you're looking at a lot of efficiency losses, that there's opportunities there. And so what do we do with technology to help us with revenue cycle? Well, again, we take a lot of the data from the patient's systems, and that the coders go through it. They make sure that everything is coded appropriately. We have what we call CDI teams, clinical documentation improvement teams. And so finance pays close attention to a metric that we call case mix index, CMI. So as I was mentioning earlier, that DRG has a weight, but when we add them all up together, all of the different patients, we get what we call a case mix index. And if that case mix index shifts, it may mean, as I mentioned earlier, that we have shifts in the trends, or it might also mean something that maybe we aren't documenting appropriately. We want to make sure we're taking advantage of that we're doing our documentation appropriately, and we're getting the full reimbursement for what we've actually earned. And so we have teams that review the data to make sure that, yep, everything was done properly, or, oh, there's some opportunity there that we missed. And so we can work with individuals and people to educate on, okay, making sure we have the appropriate documentation. And as I mentioned earlier, tracking shifts in the business. And so really the big thing about this is it sounds like it's complicated, and maybe it does kind of all happen in a black box, so to speak, but this really helps us drive efficiency in healthcare, or I think there's more opportunity to drive even more efficiency, because if we can make this particular cycle, revenue cycle, more efficient overall and with data, then it helps the entire healthcare process become more efficient. And then I'll talk just a little bit about data analytics. I think this is probably one of the biggest areas for opportunity as well. Right now, healthcare is flooded in data, and I don't know if you've heard this. I've heard several people say it over time that healthcare is 10 years behind the rest of the world in terms of technology. That may or may not be true, but one thing is true is that healthcare is absolutely flooded in data, and we're just now really seeing this push to learn how to transform that data into new actionable information. And basically, we have entire teams that work with the data, that on the back end, they look at everything from patient information, cost information, creating dashboards and charts for operational leaders to use. For example, a ED or emergency department turnaround dashboard to understand how quickly are we getting care to individuals that need care, and why, if we're seeing gaps in that, where are the gaps and why are they happening? And so this area is a big area of opportunity that is growing rapidly. What do we do, or how do we do with this